Hi everyone! Today I will be discussing poverty and its impact on women's health, specifically in the United States and India. Women around the world experience poverty at higher rates than men, and this has direct effects on their health, access to healthcare, and overall well-being. Okay, to start off, I'm going to go into a little bit of depth of what poverty really is. It is generally defined as the lack of an acceptable amount of money or material possessions necessary for a basic standard of living. There are different levels of poverty. The first criteria refers to individuals who are on the brink of starvation or at risk of dying due to extreme conditions. The second criteria includes those who have their basic needs met, such as food, shelter, and clothing, but still live with much lower standards than the rest of society. Additionally, as mentioned before, according to the U.S. Census, poverty rates for women continue to be higher than those for men, highlighting ongoing economic disparities. This topic is important because women's health is often overlooked in discussions about poverty, even though poor health can keep women trapped in the cycle of poverty. In both the US and India, poverty affects women in different ways due to social, economic, and healthcare system differences. Women in poverty face significant health risks, including malnutrition, maternal mortality, chronic diseases, and mental health disorders. In the U.S., economic disparities and systemic healthcare inequalities disproportionately affect Black, Hispanic, and indigenous women. In India, cultural factors, a lack of healthcare infrastructure, and widespread poverty exacerbate health disparities. However, despite some of these differences, both countries share similar struggles when it comes to gender inequality and access to healthcare. Throughout this presentation, I'll explore why women are more likely to live in poverty, how poverty affects their health, and what can be done to address these challenges. I will also include some key statistics to provide a clearer picture of the issue. So for part one, I'll be discussing the demographics of health issues affecting women. Let's take a look at the prevalence, incidence, and mortality rates of women's health issues in both the United States and India. In the U.S., women in low-income communities experience higher rates of chronic conditions such as diabetes, hypertension, and cardiovascular disease. This is largely due to limited access to healthcare and poor diet, as noted by the CDC in 2023. Poverty doesn't just affect physical health, it also has a huge impact on mental health. Low-income women experience higher levels of anxiety and depression due to job insecurity, financial stress, and lack of support. In the U.S., mental health services are expensive and not all insurance plans cover therapy or counseling. And in India, mental health is often stigmatized and many women never even seek professional help. When it comes to maternal health, the maternal mortality rate in the U.S. stands at 23.8 per 100,000 live births. However, the disparity is alarming. Black women are 3 times more likely to die from pregnancy-related complications than white women due to systemic healthcare inequalities, as highlighted by the WHO in 2022. Shifting our focus to India, maternal mortality rates are even more severe, with 103 deaths per 100,000 live births, according to the World Bank in 2021. Additionally, over half of women between the ages of 15 and 49 suffer from anemia. This is primarily caused by malnutrition and limited access to healthcare, as reported by the National Family Health Survey in 2020. Another major concern is the rural-urban divide. Women in rural areas face significantly worse health outcomes due to the lack of hospitals and trained medical professionals. These statistics highlight the urgent need for improved healthcare access and policies to address disparities in both countries, especially among marginalized communities. Now let's talk about how poverty impacts access to healthcare. In the U.S., women in poverty are more likely to be uninsured. Although programs like Medicaid provide some coverage, many women don't qualify due to income limits. Even for those with insurance, high copays, deductibles, and out-of-pocket costs make healthcare difficult to afford. In India, the situation is even worse. Women in rural areas often live far from hospitals and may not have access to doctors. The cost of medical treatment, lack of awareness, and social restrictions keep many women from seeking care. According to the World Bank, only 37% of Indian women have access to skilled medical professionals during childbirth, leading to high maternal mortality rates, as mentioned before. In both countries, women sometimes prioritize their family's health over their own, and many women delay seeking medical care because they are expected to take care of their children, elderly parents, or husbands first. This can make treatable conditions even worse. As far as some statistics, in the United States, women in the U.S. face extremely high healthcare expenses. For example, the average hospital childbirth costs around $13,000, while a C-section can cost over $22,000. A study found that 32% of Black women and 27% of Hispanic women report discrimination in healthcare settings and in hospitals, which proves the racial disparities. And also, women without employer-provided insurance or Medicaid, like I said, face significant obstacles in receiving regular care. As far as India, nearly 70% of India's population resides in rural areas, yet only 37% of doctors are available in these regions. Women's health issues, particularly reproductive health, are often not prioritized due to cultural beliefs that discourage discussing gynecological issues. And again, as mentioned prior, many women are unaware of the available healthcare services because of their lack of education. Many government hospitals are underfunded and understaffed, limiting effective treatment. Part 2, I'm going to go into the demographics of the countries. In the U.S., economic disparities play a major role in health outcomes. According to the U.S. Census Bureau in 2022, 12.9% of women live in poverty, with single mothers and minority women being the most impacted. Government aid programs like the WIC, which stands for Women, Infants, and Children, aim to improve nutrition and maternal health, but there are still significant coverage gaps that leave many women without adequate support. When it comes to healthcare, the U.S. offers both private and public options, but Medicaid eligibility remains limited, meaning many low-income women still lack health insurance and struggle to access essential services. And now looking at India, economic disparities are even more severe, with 21% of women living below the poverty line as reported by the World Bank in 2022. Rural populations are especially affected, facing harsher conditions and fewer opportunities for healthcare access. The government has implemented programs which provides financial aid for maternal health care, but many women remain unaware of these services or unable to access them due to systemic barriers. India's healthcare system is also a mix of public and private options, but the public sector remains underfunded, making it very, very difficult for low-income women to receive proper care. These demographic challenges highlight the importance of stronger healthcare policies and better outreach programs to ensure women, especially in vulnerable communities, receive the support that they need. In part 3, I'm going to go over the cultural similarities and differences seen in women among these chosen areas. Now let's compare the similarities and differences in how poverty impacts women's health in the U.S. and in India. First, there are key similarities between the two countries. Gender inequality remains a major issue affecting wages, job opportunities, and access to healthcare. For example, in the U.S., women earn about 82 cents for every dollar a man earns, with even wider gaps for Black and Hispanic women, according to the U.S. Bureau of Labor Statistics in 2023. In India, the wage gap is even more severe, with women earning about 19% less than men on average due to gendered labor roles, as reported by the World Economic Forum in 2023. Another shared challenge is the stigma around reproductive health. Taboos surrounding birth control and sexual health prevent many women from seeking care and making informed decisions about their bodies. However, there are also important differences between the two countries. In the United States, mental health services are widely available, but affordability and access remain major barriers for low-income women. In India, cultural norms often prioritize family decisions over women's health. In many rural communities, women need permission from a husband or a family member to even see a doctor, which really can delay or even prevent treatment for serious conditions. Additionally, the healthcare systems differ. The U.S. has more structured policies, while India's system is highly decentralized, especially in rural areas, making healthcare access inconsistent. Ultimately, even though the U.S. and India have different levels of economic development, women in poverty face similar struggles. In the U.S., racism, lack of affordable healthcare, and job discrimination contribute to poverty among women. In India, cultural traditions, rural poverty, and gender roles limit women's financial independence and healthcare access. Despite these differences, though, one thing is clear. Gender inequality is a major reason why women remain in poverty, and poverty has a serious consequence for women's health. Now I'm going to discuss in part 4 the ethical considerations and action. So, let's explore some key initiatives in both the US and India that aim to support women's health, especially for those in poverty. In the US, we have a such thing called Medicaid expansion. This program increases healthcare access for low-income individuals, but not all states have adopted it, leaving gaps in coverage. We have community health programs, but these initiatives provide free or low-cost care to underserved populations, helping women who struggle with medical expenses. As far as nonprofit organizations, we have groups like Planned Parenthood that play a crucial role in offering reproductive health care services to low-income women, ensuring access to birth control, screenings, and prenatal care. As for India, the National Rural Health Mission, launched in 2005, this government program improves healthcare access in rural areas through mobile medical units, community health workers, and telemedicine. As far as free maternal health services, the Indian government provides financial aid and free healthcare for pregnant women, but these services are often underutilized due to lack of awareness and accessibility issues. While these initiatives show progress, significant challenges remain in both countries, particularly in reaching the most vulnerable women. Expanding awareness, funding, and accessibility will be crucial for improving health outcomes. When discussing healthcare and poverty, ethical concerns play a major role in shaping women's access to medical care. Many women lack knowledge about their healthcare rights, leading to uninformed medical decisions. Example: in India, studies reveal that a significant number of women undergoing sterilization procedures were not fully informed about the risks or alternative options. This raises ethical concerns about autonomy and medical transparency, especially in vulnerable communities. Also, balancing healthcare costs with limited resources creates ethical dilemmas, especially in underfunded regions. Governments and healthcare providers face tough decisions on who gets access to life-saving treatments, often leaving low-income women with fewer healthcare options. These challenges highlight the need for stronger policies, better education, and ethical healthcare practices to protect women's rights and well-being. So, to expand a little bit more, in the US, several key programs aim to support women facing poverty and improve their health outcomes. One of the most notable is Medicaid, which provides healthcare coverage to low-income individuals, including women, children, and seniors. Medicaid helps cover essential services such as prenatal care, family planning, and mental health services, which are crucial for women who may otherwise struggle to afford healthcare. Another important initiative is the Women, Infants, and Children program, which I did mention briefly, which offers nutritional support for low-income pregnant women, new mothers, and young children. It also provides access to nutritious foods, breastfeeding, education, and referrals to health care services, ensuring that women and their children have the resources they need for healthy development. The Temporary Assistance for Needy Families program is also pivotal in addressing poverty. It provides financial assistance and work opportunities for low-income families, which often include women-headed households. This program helps alleviate immediate financial stress and supports long-term self-sufficiency through job training and education. The Affordable Care Act has expanded access to health care for many women, especially those in lower income brackets, by allowing women to access essential services like cancer screenings, birth control, and maternal care without excessive costs. The ACA plays a significant role in reducing health disparities caused by poverty. We also have Planned Parenthood, community health centers that are federally funded clinics that provide low-cost or free healthcare services to underdeserved populations. We have the National Breast and Cervical Cancer Early Detection Program, which is providing free cancer screenings, diagnostic services to low-income and uninsured women. We have housing assistance programs that helps women and families access affordable housing and escape unsafe living conditions. We have Violence Against the Women Act. We have the Child Care and Development Block Grant, which allows them to work or attend school. We have the Healthy Start program that focuses on reducing maternal and infant mortality among undeserved populations by providing healthcare resources and education. Together, these programs aim to address the intersection of poverty and women's health, promoting better outcomes for women and families across the country. In India, several programs aim to improve the health and well-being of women, particularly those living in poverty, as well. These initiatives focus on providing healthcare services, financial support, and social empowerment the best that they can. One such initiative is the National Health Mission, which aims to ensure accessible and affordable healthcare for all, especially in rural areas. This program focuses on improving maternal and child health by offering free medical services, health checkups, and vaccinations. It also works to improving overall health infrastructure in underserved regions, ensuring that women have access to essential services. Another key program is the Maternity Benefit Scheme, which provides financial assistance to expectant mothers. This program helps cover some of the expenses during pregnancy, childbirth, and the postpartum period, aiming to reduce the economic burden on low-income women. It also helps ensure that mothers can access proper care during these crucial times. The Safe Delivery Program is designed to reduce maternal deaths and complications by encouraging women to deliver in healthcare facilities. This initiative offers cash incentives to women who give birth in government hospitals, ensuring they have access to safe, institutionalized care, especially in remote areas where traditional birth practices may still prevail. In addition, the government has launched a program that promotes the education and safety of girls. This initiative works to protect girls from harmful practices like child marriage and advocates for their access to education and healthcare. It encourages families to prioritize girls' well-being by offering financial incentives for their education and healthcare needs. A significant program aimed at improving sanitation and health is the Clean India campaign, which focuses on improving sanitation conditions, especially in rural areas. Better sanitation means reduced health risks for women who are often the primary caregivers and responsible for maintaining household hygiene. This program also includes the promotion of menstrual hygiene management, a crucial aspect of women's health. Another one is the Women's Empowerment Program that supports women in rural communities. Through this program, women are given resources and training to become more self-sufficient. It provides health education, helps women access health care, and offers skill-building workshops to enhance their financial independence. The Girl Child Savings Scheme also plays a crucial role. This encourages parents to save for their daughters' futures by offering financial support for education and health needs. This helps alleviate the financial pressure that many families face and ensures that girls can access essential services. Finally, there's a program that focuses specifically on the health of young girls and adolescents. This program addresses the unique health challenges that young girls face, including reproductive health, nutrition, and mental well-being. It ensures that girls have the resources and support they need to grow into healthy, confident women. Through all of these programs, the government of India aims to address the intersection of poverty and women's health, that is offering support and resources that can make a significant difference in the lives of women across the world. So for part 5, I'm going to be talking about the summary and conclusions. Clearly, the link between poverty and poor health outcomes is evident in both the U.S. and India, but cultural and systemic factors shape different challenges in each of the countries. We saw that women in poverty face significant barriers to healthcare, including cost discrimination, inadequate infrastructure, and lack of education. But I believe policy changes, increased funding, and better education opportunities are essential and needed to reduce health disparities, improving the outcomes for impoverished women. So what can we do to address these issues? We need to expand healthcare access. Providing affordable or free healthcare for low-income women could prevent many health issues from becoming life-threatening. We need to invest in women's education and jobs. Helping women access higher paying jobs and education could break the cycle of poverty. We need to improve maternal health care. Increasing prenatal care access and addressing racial disparities in healthcare would reduce maternal mortality rates. As far as advocating for policy change, stronger policies supporting paid maternity leave, affordable childcare, and workplace protections can help women balance work and family responsibilities. Specifically, a strengths orientation to poverty opens up radical possibilities, particularly in India, where the state-sanctioned self-governing body, the Gram Sabhas, has a mandate to provide for the most marginalized groups in the self-help group. Bank Linkage Program in India is a model for microfinance that promotes the tripod of microfinance, women empowerment, and poverty alleviation for inclusive and sustainable development. So I also wanted to reflect a little bit. Through this research, it became really evident that poverty has a profound impact on women's health in both the US and in India. The disparities between urban and rural healthcare, racial discrimination, and gender norms highlight the need for inclusive policies and better resource distribution. Addressing these challenges requires government intervention, healthcare reforms, and grassroots advocacy. Improving education on health rights and increasing awareness of available resources will be essential in bridging the healthcare gap for impoverished women. My discussion questions include: how do gender roles make it harder for women in poverty to get health care? What programs or help do you think could make life easier for women in poverty? And how does being poor affect women's mental health, and what can be done to help? These are my references, so thank you all for listening, and I hope you learned a lot more about women's poverty, especially in India and the US. Thank you.